Our first question, what can you tell us about the malaria tutorial? How did you decide to focus on malaria initially?
Actually, I had been brought to NLM in 1997 to work with a project that NIH had taken on under then Director Harold Varmus to help African malaria researchers. And one of the things they wanted was better access to the internet and to medical literature. And that's the work that I had done previously. So I was brought here to do that and stayed on, and became very interested in NLM's attempt to reach the end user with information. And this happened right when I came as well. In 1997, PubMed made Medline available to the public, and not too long after that, Medline Plus made health information generally. Now there are over 700 topics available to the public. And of course, it's not just patients that use that information, doctors use it. It's impossible to keep up with everything. And so doctors like to go to that site and they get the latest news and a lot of things. And so those topics are chosen. Users can write in and say how they think a certain topic is important and is not there yet. And that's kind of how Medline Plus has been built. For the African tutorials, I have an all-African advisory board that spans countries all over the continent. And although we knew the burdens, generally what the top burdens would be, it needed to come from them, not from us. And so, you know, I asked them what they thought the 10 top health burdens were in their areas. And of course, malaria and HIV and TB are at the top of the list, no surprise there, but it was important that it come from them. In Uganda, where I was based and where we worked with students and faculty and artists on these tutorials, malaria is the #1 health burden and kills from 70 to 110,000 people a year.
You conducted a baseline survey about malaria. What did the study reveal about the knowledge of the causes and measures one can take to prevent malaria?
The survey was very interesting, and it was carried out by students, medical students from Makerere University in the Mufumi village in eastern Uganda. It revealed so many interesting things. One was, let's see, where do we start? One was that a lot of health messages have been sent to folks. You know, a lot of organizations come in and give health messages. And people pick up on health messages. They don't always connect the health message to the health challenge. So you had some cases where, and this happens with all of us, I think, you have some cases where people were saying, responding to, can malaria be prevented? They would say yes. And then the question was how? And they would say, use latrines, drink clean water, things like that. All of which are good things to do, none of which has anything to do with preventing malaria. So it's a challenge to connect health messages with the actual issue at hand. Now, the problem with malaria is that you get that bite from the mosquito, and it's 2 weeks before you get sick. So it's a natural thing that you don't necessarily connect malaria, your sickness, your fever, with that vector. So one piece of what we were trying to do in the village was make sure that people understood that it was a vector issue. And until they understand that, nothing's going to happen, really.
What role did the Ugandans play in the success of this tutorial?
The Ugandans were responsible completely for the success of the tutorial as far as the use of it on the ground. The making of it, they shared success with the team at NLM. But once it was made, you know, you can have a beautiful tutorial, but it's not necessarily going to be used. And even if it's used, it has to be used so that it can make better health in a country. That's the idea. So So their role was major, and I think they understand that very clearly, and they own it very clearly, that it's their tutorial that they made, and they're sharing it with other people, other students in the region. They're very articulate in talking about it, and because they went into the village and made these discoveries that mangoes don't cause malaria, that witchcraft doesn't cause malaria, you know, it's like any discovery. You want to share it, and you want to make it, integrate it into the presentation so that people see their views reflected in what's been done. It's not just something coming from the outside. It's something that even the village folks have had a hand in, and it's held up, and they see their views in there, but hopefully also understand that they need to perform certain things or do certain things in order to prevent malaria.
Is there any way to measure if there was a shift in behavior as a result of the tutorial?
Right, that is the challenge. In Mafumi Village, we're working with the health center. That's a wonderful health center, and the person who's in charge of it is Nurse Sister Goretti. And she, each month, sends to the district health office, which sends to the ministry, all the records on how much malaria morbidity, how much malaria mortality there was that month. So what we can do over time, and of course there are many things that affect morbidity, mortality, malaria, not just this health information intervention. But in a highly malarious area like Mafumi Village, we think that over time we'll be able to see some kind of change, hopefully, for the better. And that some of that, because the nurse sister sees everyone who comes in, she'll be able to see how the tutorials have played a role in that. How the people look at these visuals and hear what's being said, and when it's presented in that way, and that way meaning on the screen of my little laptop in the village, or on the screen that they've set up for people to look at, the difference that kind of intervention makes vis-a-vis posters and booklets and things that people normally do. So we're doing a couple of things. We're creating a tutorial that incorporates beliefs of people in the village, and that's an important and different kind of thing to do. We're making it in their languages. We're also presenting it in some new formats, like on the computer. And she says when people see it like that on a screen, that somehow it does make a difference, because they, I think in a way they can put themselves into it. It's like watching a movie.
We're seeing a shift in the way that people are obtaining information, with more Americans getting information from electronic media. How did the Ugandans respond to the materials that were presented in an electronic format as opposed to a hard copy?
Well, according to Nurse Goretti, when people were looking at the tutorial on a screen where you could punch a button to advance it to the next screen, that it was very interesting how people were drawn into it. They were drawn to the visuals, they were drawn to the information, and gradually became kind of immersed in it in a way that was different from posters and booklets. So we believe that there's something about the screen and the digital presentation that could make a difference. We'll be exploring that over time, and longitudinally we'll be seeing over time how those morbidity and mortality records change, because that's the bottom line, isn't it?
For more information on the tutorials, visit www.nlm.nih.gov/medlineplus/Africa.